Well, hello again. If you've seen our boxer breeding and whelping series that we put out 2 years ago, there's a notable miss in that series, and that is birth. And then even I think we may have included some information after birth, but we kind of lost it at the birth because we were out of town. We had to move. My wife and I had to move our daughter to college, so our other daughter ended up whelping those puppies, helping whelp those puppies, and that was 2 years ago. And this is one of those puppies. Her name is Shugga. Shugga's mahogany. She's fawn, but she's a deep fawn, which makes her mahogany. So we're going to talk a little bit about whelping and some of the observations prior to whelping. And she's getting close, not necessarily in days, but in behaviors. And so we yet don't know how far along or how much longer we're going to be. And let me say this is first and foremost, every dog is different. No two dogs whelp the same. There's some commonalities, but there's always differences. And you're seeing one difference right here, and that is that this little girl is just as happy as a lark to lay here in her whelping kennel. Most of our girls absolutely did not want to be in here. They felt a bit too isolated. And this girl, she'll lay in that whelping pool and just chill, which is good. It's not necessarily a sign that she's ready to have babies, but it's a good thing either way. Let's talk a little bit about the signs that we think she's ready. First, our expectation is her earliest due date would be Wednesday. This is Sunday. So we're a few days in advance of what we thought was the earliest whelp date. But she did not breed here. She bred at a local kennel, no, not local even, hour and a half from here. So she went on her honeymoon to marry her husband, and as my wife likes to say. And so we don't have, we have an exact date, but something might have happened before that date that they were unaware, we're unaware of. And so that's fine. And even if Wednesday was her 9-week, doesn't mean that she won't do quite fine. One of the things that she's also not exhibiting for a mother who's near to birth is panting. I expect she'll start panting later if she's going to give birth tonight. But right now she's not panting, and that's very typical. A very typical behavior for a laboring mother is that they pant. They pant to basically get rid of heat. Their body's muscles are working, whether you realize it or not, we realize it or not. And so they pant to get rid of that heat. And so generally in active labor, every mother will pant. Oftentimes they'll pant earlier. It just depends on the magnitude of the labor, the contractions. So let's talk about where she is, or let's talk about why we think she might be fixing to whelp. She quit eating last night. She quit eating at her dinner meal. She's got a good appetite generally, but last night she decided no, she didn't really want to eat anymore. And then this morning she didn't eat, and then I brought her a noon meal, midday meal, and she also passed on that. And for her, that's pretty rare. And generally mothers will stop eating, generally within 24 hours of birth. So we expect that we might be there. There's a number of other signs you can go for. You can check temperatures. We don't bother with that because it's kind of a hard data to interpret with any significance. So we think she's getting close, and that we'll see shortly. She's in her whelping box. We're in the whelping room, which is a soon-to-be master closet. Here's our master bedroom, and this is soon-to-be our master closet once cabinetry's constructed in here, and we've used it now a number of times for whelping because I'm just that slow about getting this closet done. So what we have is an inexpensive 5x7 rug. We have a 4x4 box. Generally we have some thick plastic that goes over this. We just couldn't go pick it up today. So when we get it at Hobby Lobby, it's Sunday, they're closed, so we'll get it tomorrow. Then for the actual whelping birthing process, we have a pool, and this is a 3-foot diameter pool inside of a 4-foot box, and we line it with all kind of absorbent towels, blankets, and things because whelping is not a clean process, a lot of fluids involved, and so we have those in there. And So we're in the whelping room. A few key things. We have a night light so that whenever we want her to relax with the light off, we have that option. We also have a linen station. Tons of linens here in this wagon. Some puppy pads. You need lots of linens to raise puppies. There's a heat lamp there, which once she starts whelping, we'll use the heat lamp. We keep the house 72, 73 degrees. Puppies don't necessarily like that. And this room has its own air conditioner vents. This room stays pretty much average home house temperature, so we're going to warm up at least on the puppies themselves. And we use an infrared bulb, and so that we'll use once the puppies are born. We have a scale. We have our whelping box. Covered this in an earlier video, but in the whelping box, we have forceps, a suction ball, scissors. We have dental floss, which is to tie off umbilical cords. Yeah, all those things. They're necessary. If we get to whelp on video this time, I'm going to show you a little bit of those things in use. We also have our dry marker board and our dry markers. This is where we take note of. So here's our white marker board as well. Here we'll notate birth order, markings to distinguish the pups in order, and we'll put their birth weights, and then we'll track weights over time. We'll also record dates for tails and dew claws, dates for, first dates for worming, shots, all those things. This is kind of the central for information. I tend to move the weights into Excel, and I like to graph them. If we have a slow gainer, we'll tend to put her on an inning. More frequently, make sure that he or she gets their nutrition. A lot of cleaning supplies. You cannot have enough cleaning supplies in a whelping room. You can not have enough cleaning supplies, nor enough linens. Yeah, that's one thing. That's something you definitely need. So, Mama's chill. She's relaxed. One other thing I was gonna show you that's a sign of near birth, and depends upon the dog, obviously, and that's what you see right there, and that's her labia that's distended, and it's common with heats, and basically it's just a softening, elongating, tends to turn downward. I don't know if it's to guide the puppies toward the ground. But it just guides the puppies out, and it softens, easier for her to pass the babies. And so that's also a common sign. That happens, can happen a week or two before birth. So it's certainly not a sign of imminent labor. One other sign, and one that she did just a while ago, sometimes you'll take them out to go to the bathroom, particularly if it's their first litter. They're less certain of what all's happening, and that is that they'll go into a position to have a bowel movement, but yet they won't. They're pushing. They're not sure exactly what that means at this point. They just know they have an urge to contract, not necessarily push, but an urge to contract. Our very first boxer mama, her very first puppy, she nearly had outside. We took her out for a bathroom break a few minutes after her water broke, which wasn't a great idea, as it turns out. And I managed to catch puppy as it was coming out with her in a squat, as if she was going to use the restroom. And so yeah, they don't always understand a contraction or a push or an urge to have a bowel movement. They don't know the difference necessarily, particularly on the first go round. And this is Shugga's first litter. So anyway, let's see what she does. Time will tell. I want to include one more subject here before the whelping process begins, and that is, how much help does mama need during whelping? There's a school of thought out there, and I certainly won't argue with it, that the right thing to do is close the door and come back later. And then there's a school of thought that says do it all for her as much as possible. We land toward the middle, maybe a little more toward doing it for her than some do. So why don't we just let her do it? Well, let's talk about it. In the wild, they would do it themselves. The mortality rate in the wild, both for the bitch and for the puppies, is much less than we're wanting to accept. We're or let me say the death rate, not the mortality. Mortality is low relative to what we're willing to accept. And so we choose to be more proactive with birth, with whelping. And so we do a reasonable amount for her. Obviously, she pushes the babies out. We don't pull babies out. We don't palpate mother. We notice we don't put our hands inside places they don't belong. If that needs to happen, a vet needs to do it. We have only on one occasion pulled a puppy, and that was a traumatic situation, and it was not with one of our girls, but with a kennel we were associated with. That puppy turned out fine, but it's not something that we practice. Basically, mother brings baby into the world. We monitor times to make sure that she's progressing normally. And when the babies come, we tend to take over. We'll take the baby away. We'll use a forceps to pinch off the umbilical cord to stop bleeding. We'll cut the umbilical cord. If the bleeding doesn't stop at the umbilical cord, we'll use dental floss to tie it. Most often, if you put a clamp on it for a couple of minutes while you're drying off the baby, bleeding will stop on its own. And we also remove most of the afterbirth. We might allow her to have one or two of the afterbirth, but we don't allow her to have it all. And you might say, well, that's not natural. Well, in nature, she would be giving birth to these babies in a den, and she would be doing that as much for removing odors and things like that as she would for nutrition. Our bitches get very good nutrition. We're very cautious about high protein, high iron diets after birth because we know she needs that. Now, if you let your mama eat, 7, 8, 9, depending on how many puppies she has after birth, she can also spend days very constipated because of the high iron content. We just don't find that useful. So we limit her to 1 or 2 afterbirths. The rest we dispose of. And then again, we're feeding her and feeding her well. So we're not worried about her nutritional requirements. We're handling that without regard. So, the level of involvement is very much a personal thing. Sure, they're animals, and in the wild, they would handle it on their own. We've domesticated them. We've taken responsibility for them, whether we choose to help birth babies or not. We've taken a certain level of responsibility, and that responsibility extends even into birth, in my opinion. And so we do take an active role in the birthing process. It's particularly relevant for new mamas. If you consider wild dogs, which these aren't, first litter mortalities, it's very poor. And it can also be very poor for mom. And so we just don't accept that risk for mom or the puppies. We take over in that case because we take responsibility for this dog because it's domesticated and not a wild dog. So you can be of any school of mind that you like. That's our school of mind, and we're going to try to be as responsible breeders and owners as possible. We feel like helping out with birth is part of that. So we'll have some birthing clips here, we hope, and kind of show you the process we go through when a puppy is birthed. 24 hours after the prior segment, we finally have water breaking. Little girl still hasn't eaten. You see she's actively panting. She's certainly in labor. Water breaking kind of gives that away too. In the end of the day, your dog's in labor when the first puppy pops his head out. Very hard to interpret their signs. This little girl has gone now 36 hours without eating, which is abnormal for our mamas. She also has a good appetite, but she went off feed over 36 hours ago, which we don't like because we want her to be nutritionally sound whenever she has puppies, but it's not our choice. It's really not even her choice. So you can be sure she's going to be thin when she finishes giving birth. But don't you worry about that. We will put some food into her. Her appetite will return very shortly. and we'll be pouring 3 full meals a day at her or more. You'll notice that she's almost dry heaving. It's not uncommon during labor. You have a dog that'll throw up. In the case where their belly's truly empty, they'll tend to sometimes dry heave. And she's done that a couple times, but not too much. So anyway, her water just broke, so the clock is on. I expect a puppy within from now to an hour from now, and but the timer has started, so we expect some action. All right, well, we're ready to go. I've got the white marker board down here. Got it written. I got some things written on it. We generally register the puppy number, time the puppy was born. We do that so we can track gaps between puppies. They'll oftentimes have multiples, and in the rest period, then multiples. And if they go too long, then might need to see about taking her to the vet. The gender of the puppy, the weight of the puppy, and then distinguishing markings. You know what color they are. They're all should be fawn, but some will be fawn. Some will be fawn with flash, full rings, partial rings, markings on the nose, things like that. So anyway, it's not going to be long now, and we're going to start having puppies. Right now I'm at home by myself. You'll notice towels, lots and lots of towels. There will be puppy juice everywhere. And whenever I bring the puppies out, I'll need to dry them off. Also, we'll relocate forceps and scissors down there to be prepared for puppies. But I'm by myself right now, so we'll see how the videoing goes. But we'll do what we can, and I'll certainly have help a little bit later. So let's get this show on the road. Forceps.
Yeah, where did Riley put them?
Right here. Alright, so there's a puppy. We took his little bag off. And we're going to use a pair of forceps or a clamp to clamp off that umbilical cord. About a 1/4 inch, 1/2 inch down from the body. And we're going to trim it off. Give Mama to get her tongue in the way. And we're going to put the forceps right up under the belly. We're going to get rid of the placenta. Mama doesn't need that much placenta.
Oh my.
And we're going to get the towel. There we go. And look at his little mouth. He's trying to breathe. We'll give him a good rubbing. Let Mama lick his face a little. Lick his face, Mama. Or her face. I don't even know yet. I forgot to look. There you go, Mama. Mama doing her part. Yeah, good job, Mama. Okay. Yeah, what you think? You got the towel now?
Yeah, I just want to know what it is, so I know what color.
Okay. It is a little boy.
Finally.
A little boy. And he is very much fawn without any flash. Mama is
Like he had a
working.
white strip on
Oh,
his
he
head.
does. He has a white blaze on his head, Mom. You are correct. Mama's working him. Got him going, Mom? Lick that face. You're breathing good. There you go. Oh, yeah. Good job, Mama. Okay, well, we'll go ahead and check his weight. Take off his little clamp. Leave the clamp on there like that for a few minutes, and it helps stop the bleeding on the umbilical cord. We're going to pass him over and let Mama get his weight.
Hi, first little boy. Here's Mama's first little boy. 12.2.
12.2.
Here's Mommy. He's yours.
He's all yours.
He's yours, Mama.
We definitely like to get him back to Mama as soon as possible. We just like to make sure. One thing that you'll find is that particularly new mamas sometimes tend to, normally they would chew the umbilical cord off. Sometimes they'll chew it very short. It can cause them to bleed more. And it's just an unnecessary issue. So that's why we like to go ahead and bring them out of the bags, deal with the umbilical cords, and then let Mama start licking them off. So we try to give help, hopefully minimal help, but good help. All right, well, so far we're about 5 pups in. You can see this is a It begins to look like a bit of a battlefield after you have a number of these pups. You can be sure as soon as she's done, we're confident she's done with pups, then we'll be cleaning everything, changing everything. She'll be working to clean it up just as well. She's good like that. So she's resting right now. She's had 5 pups in an hour and 10 minutes. That's a pretty good clip. She started slow, but she's progressing well. I told my wife I was just hoping they were all lining up at the door during those hours of wait. Looked like they were because they're coming on out. So we got 2 boys and 3 girls so far. And they're all really quick to latch, nursing well, and yeah, doing good. So this is the runt so far. He weighs 9 ounces, 9.6 ounces. And then the heaviest one weighs 14 ounces. So that's kind of our spread so far. Most of them are around the 13, 14 ounce mark, except for a little flashy guy here, who is, wait a minute, am I calling this right? No, I'm sorry, that's a female. This little full flashy is a female. And so yeah, we're doing good. Mama's checking on her baby because her baby's trying to crawl away, huh? Let me help you, Mama. Here you go, Mama. There you go, baby. Yeah, she doesn't like her baby's getting away at all. Baby gets too far, she's gonna go after him. Anyway, so we're still having babies. She's still got more to go. And we'll update you again. There you go. All right. Okay, well, we're fixing to have our 6th puppy. And hopefully you can see, I'm not gonna pull him. He's almost out. He or she is almost out. So we'll just let Mama push one more time. And he or she will come right on along. Not in a great big hurry here. Mom will handle it in a minute. She just needs to give another push and he'll be out. Now this is where I could reach and grab him, but I don't do that. I try not to do that. Just let Mom work up one more push and then she'll be out. Come on, Mama. Move that puppy out, except to break my own rule. The last one was breech. This one's actually coming out forward. You can see there's a little ear right there. But you can see through the sack, a little ear right there. And so we're gonna give a little hand because he's not in there by much, so I'm not really having to pull too much. Now some of these little guys, all right, Mama. So first thing we're gonna do is we're gonna tear the sack, a little membrane that covers him, and we're gonna pull him up. And sometimes the afterbirth will be delivered rapidly like this, and sometimes not so much. So we're gonna take that away, and we're gonna get a pair of forceps, and we're going to get this little cord on this little boy. It's a boy. And then we're going to take some scissors and we're going to trim that cord just back from the forceps. There we go. And then we're going to move little guy with the forceps. There we go. We get rid of the afterbirth. We're going to grab our rag. And we're going to start working on the little fella. So first thing we want to do is get him to breathe. We'll let Mama help us with that. As she licks his face, that stimulates him to breathe. We can also stimulate him to breathe by rubbing him with our towel, which also serves to dry him off a little bit. And Mama just loves to love him, and this also helps with bonding. Helps Mama bond with the baby. So the more she can be involved, obviously, the better off we are. Good girl, Mama. Good girl. So then what we normally do is after she's had time to get him going really good, we would take off this forcep, make sure the umbilical's not leaking too badly, if at all, and then we would get a weight. So we've got a gender, we've got a birth time, and we'll also note his markings. He's pretty much just a straight fawn.
Stomach.
Yeah, of course they'll have white on their stomach, but he's just straight fawn, no real significant distinguishing marks. So Mama, let me take this off, and then we're going to get his weight. After I take that off, I like to look at his little umbilical cord, make sure that it's stopped bleeding. That was a little long, which is no problem because the way I was holding him. You like him, Mama? Is he a keeper? Is he a keeper? Let's see if he's a keeper. Let's weigh him and see if he's a keeper. I know. Mama's not real big on us taking him away.
13.8.
13.8, that's a keeper. So there we go. Mama's gonna keep licking him. We're gonna put him right here with Mama. And she is gonna spend her time loving that baby. Well, flip him down into the pile. And so that's number 6. Well, we think we're done. While we're there, let's touch on that subject. When are you done? Well, you're done when she's done, and you'll know when she's done when she doesn't have any more babies for a while. There's really no magic bullet to know when you're done. Right now, she was just napping. I just woke her up from a nap, which means could mean she's resting for the next puppy, or it could mean she's done. I think she's done. You can generally kind of tell after a litter or two. They get a certain demeanor about them. She has 8 very beautiful puppies, which hopefully you can see down in there. You'll notice they're laying on the pool right now. It's because she nested and moved everything all over the place. But once we know she's done, we'll give her another hour or so, which will give her about 2 hours since her last puppy. Once we're pretty sure she's done, we'll go ahead and take her out, let her walk, see if she wants to eat, get her some water. We'll take the puppies out, put them in a basket, and then we're going to clean up the pool real good, get rid of all the soiled linens, and then remake her bed for the night so she can care for her puppies tonight. You'll notice we have a heat lamp on them. Yeah, like I told you earlier, I think it's fairly cool in the house, and we want to warm these little munchkins out, particularly while they're still on the damp side. Don't expect this at home, but she had 8 babies in 2 hours and 10 minutes. And we've never been able to have that kind of a production rate on birth. I'm impressed. Initially, she had 2 puppies trying to come out at the same time. It was a little bit of a struggle. But she was able to resolve that, move 1 puppy out. And after that, each birth was just uneventful. She, for a first-time mom, is amazing. On the first pup, not so amazing. She squalled out a little bit at us. She bit my daughter. Didn't break the skin, luckily. But it was just out of shock, pain. I mean, I wonder how much of it's, I'm sure there's some pain, but also I think a lot of it's just pure shock and fear of what's going on. That they'll occasionally respond that way. But after that, the other 7, she never got up to have them. She laid down. She never threw the other puppies off while she had it. So yeah, she was a real trooper. She's doing great. She's loving them to death. Loving them to growth, I hope. And they're all nursing. Nursing is very important. As you have puppies, it's very important that you give them a nurse. Nursing releases a hormone in mama dogs called oxytocin. Oxytocin will advance the rate of birth. It's a hormone that helps them to push, gives them that urge to push, and it just progresses the pregnancy, progresses the delivery, the whelping along. So she did great. She's awesome, mama, by all appearance, and so we're excited about this litter. I'll show you. This is the chart. It talks about the number, the order, the time, the gender, the weight, markings, and then their names. We named them. This particular one's probably already sold, so we didn't name that one. We'll let the owner name that one because it was kind of a pre-sale. So, born 8/14/2017. Water broke 12:45 p.m. First puppy didn't come till 6:17. The last puppy was here by 8:32. So that's an hour and 15 or 2 hours. Yeah, 2 hours and 15 minutes for 8 pups. That is impressive. We've never had that kind of birth rate previously. Don't expect that. It's not normal. Anyway, so she did good, and we're going to move on. So puppy care starts, and we got 4 weeks of nursing at least. And so we'll be taking care of mama and babies for the next 4 weeks in the whelping box. And as you'll see, that has its own set of challenges. Talk to you later. Hope you join us for the next video. Thanks. Bye-bye.